During the city of Amarillo's COVID-19 briefing, health officials spoke about the COVID-19 treatment and how a new treatment could be seen in the first quarter of 2022. Thanks for joining us tonight. Fox 14's Jack Kessler has more from those health officials. That is Facts Not Fear, first on Fox tonight.
COVID-19 numbers have somewhat gone down in the area. BSA Chief Medical Officer Dr. Michael Lamentier warned that the change has not been dramatic. He urged cautious strategies such as masking and vaccination to protect from the virus. Dr. Lamentier adds that when it comes to treating symptoms of COVID-19, it's supportive care.
It's the things that we do to treat the aches and the pains and some of the symptoms of shortness of breath. Obviously, oxygen, if those individuals are low in terms of their oxygen levels. That's really those are the mainstays of our therapies.
He also talked about the promise of a new antiviral pill being developed by Merck that started phase 3 in September to treat someone who is in the early stages of disease.
That drug appears in preliminary studies to have good activity against COVID-19. And the question is, will this be available under an EUA, early use authorization, just like some of the other medications we've had available to this point, by potentially as early as Q1 of 22? Does not supplant the need for vaccination, which is the most effective way to prevent infection.
Dr. Lamentier says it's important to also get your flu shot this season.
Make sure you get your flu shots. Protecting yourself against the flu is another way to help prevent against a co-infection where you potentially get COVID-19 and the flu, which would not be a good scenario.
Dr. Lamentier says if you're still apprehensive to get the COVID-19 vaccine, you can go to reliable sources like the NIH or the CDC to see what your best protection is. Live in studio, Jack Kessler, Fox 14 News. Judd?
All right, Jack, thank you. The city of Amarillo officials continue to encourage all members of the community to get vaccinated.